Hi everybody, it's Honest John again. Now, before I start, let me just mention that I have a master's degree in psychology and spent a long time working in psych before I became a stand-up comic. So I'm going to talk about that a little bit. Now, there was a time in this country when a person, and all over the world in fact, when a person could be confined to a mental institution on the flimsiest of pretexts. Sometimes people with no mental illness at all were railroaded into mental institutions by people who wanted to get their property or because they were activists and considered troublemakers. And once confined in those institutions, it was almost impossible to get out. Because of this, over the years, laws have been passed clearly defining who can be hospitalized against their will and also to protect the rights of people with mental illnesses. So, aside from having a psychiatric diagnosis, you must be a threat to others, a threat to yourself, or so gravely disabled that you can't meet your basic needs. And over the years, there's been a lot of treatments that have been developed for mental illness. Medications, there are new medications being developed all the time and that are more and more effective. And we have a number of different therapies, group therapy and behavioral therapy and cognitive therapy. There are hundreds of different therapies to deal with different types of mental illness to varying effect. And it seems like the best approach seems to be a combination of therapies. Now, there's also kind of a mythology about how electroshock therapy is, inhumane and all that stuff. Well, over the years, it has been developed to the point where it's not traumatic at all to the people. And sometimes it can be amazingly effective in the treating of depression. So, a person can be as crazy as a loon, but if they're not a threat and they can meet their basic needs, they're still out on the street. That's why we have a lot of people who are obviously crazy, bumming change at strip malls, pushing around shopping carts, and sleeping under bridges. A large proportion of people who are homeless are what are called the homeless mentally ill. And let me tell you something, it can be very, very painful for families and friends of a person with mental illness who refuses treatment to just watch them spiral downward. Mental illness is often harder on the family than it is on the patient. If you have a physical illness, you know it. You're in pain, you feel lousy, you're throwing up or feverish. But if you have a mental illness, a lot of times you don't know it. Except in the case of depression. If a person is depressed, they know it and they know they need help. So those are the people that are most likely to voluntarily hospitalize themselves. And some people who are mentally ill, initially they can kind of sense something is wrong and they'll seek help too. Like a person who's hallucinating, who has the presence of mind to go, well, wait a second. Those voices aren't real, those are hallucinations. But a lot of schizophrenics, they think their voices are real. A lot of people with delusions, no matter how crazy they might seem to us, they make perfect sense to them. And if you're paranoid, you're certainly not going to trust anybody who tells you you're nuts. As far as you're concerned, the problem is out there, not in here. So a lot of mental illness doesn't get treated until it reaches a crisis. And then at that point, sometimes it can be pretty intractable. And most of the medications in the treatment of mental illness have side effects. And they can be pretty uncomfortable. You know, tremors and muscle twitches and dry mouth. And there are a bunch of different side effects for medications. So a lot of times patients don't want to stay on them. It's hard to get somebody to stay on a medication, especially if they don't think they're sick to begin with. In spite of all of this, the rate of violence among the mentally ill is about the same as it is for the general population. It seems that if your personality doesn't tend towards violence, it doesn't all of a sudden become violent if you become mentally ill. Now, most of what I've been talking about here is what is called the thought disorders and the mood disorders. There's also another category called personality disorders, which would take a whole other video. And maybe I'll get around to talking about that. We'll see. But in the next few months, there's going to be a lot of talk about how we can improve our treatment of the mentally ill. And I just wanted to give you guys some idea of some of the challenges involved with that. It isn't just a matter of improving our institutions. There are some very, very big challenges involved. And at this point, there's no permanent cure. Mental illnesses can only be managed, and that is not easy. But since they appear to be related to brain chemistry, it is possible that someday there will be a cure for many of these types of disorders. But believe me, that's a long way off. Thanks for listening.